Now, before we move on to understanding the Einthoven triangle, I just would want to, maybe not, this is not important for your exam point of view, but you should know your history. Now, this is a great man, Einthoven. Now, this is a stamp that was released by the Netherlands, giving respect to this great man who had invented this concept of vectors and Einthoven triangle. Just out of curiosity, have you ever thought, why is ECG named as P, QRST? Why is it named as PQRST? Just think about it. Why not ABCD? Why not XYZ? So there are many theories to this. The interesting theory is Sir Einthoven thought that if he names it at A, B, C, D, and subsequently if someone discovers a positive deflection before A, then what will he name it? So to cut down on that confusion, he just randomly chose PQRST, thinking that if later on we discover a positive wave that occurs before P, it can be named as L, M, N, O. And if we subsequently discover other waves that come after T, then U, V, W, X. So that's the history, right? Just out of interest, maybe not important from your exam point of view, but you must know this man, great man. Now, so as I told you that we have 6 leads that look at the heart, right, in the horizontal direction, which are the chest leads, right, and then 6 leads that look at the heart in the vertical direction, which are the limb leads. Now let us look at the position of chest leads, which was the question that was asked. Fine. Now we start with the V1. So V1, this lead is placed in the 4th intercostal space immediately right to the sternum. So clinically, when you have to put it on a patient, you can start by palpating the suprasternal notch, come down, you'll feel a bony prominence, that is the angle of Lewis, and that corroborates with the 2nd rib, right? So there'll be the 3rd rib and then the 4th rib, fine. So 4th intercostal space, right side of the sternum is V1. Now diametrically opposite is 4th intercostal space on the left side of the sternum is V2. Then you place V4, which is 5th intercostal space in the mid-clavicular line, and V3 is placed between V2 and V4. Now in the same plane, the rest of the 3 electrodes are placed in the same plane. So V4 is 5th intercostal space mid-clavicular line, V5 is 5th intercostal space anterior axillary line, and V6 is 5th intercostal space in the mid-axillary line, right? So these are the horizontal looking chest electrodes. So it'll give a camera view looking at the heart in the horizontal section. Now let us look at the Einthoven triangle. I wanted to draw this, right? So suppose this is a gentleman, right, standing like this, fine. It's the right leg and the left leg, the right arm and the left arm, right? And this is our beautiful heart. Okay, right. So there are 6 limb leads. Now how are they formed? So number 1 is so AVR is a augmented voltage right arm. So this is applied here. Okay. Now AVL is augmented voltage left arm. This is applied on your left arm. AVF is augmented voltage left foot. Okay, remember this, don't get confused between right and left foot. This can be quizzed in the exam, whether AVF is left foot or right foot, fine. And we also apply electrode on this, that is for the earthing. Okay, so now you have 3 cameras looking at your heart from this direction, from this direction, and from the inferior direction, right, which is AVR, AVL and AVF, fine. Great, okay. Now, so why is it augmented voltage right? So this is how I remember it. Like if you look at the chest leads, they are placed directly above the heart, fine. So the electrical activity that they pick would produce good potentials. But if the farther you go away from the heart, weaker would be the electrical activity picked up by these electrodes. It's just like you taking a very close picture clarity is great. Take a picture from far distance, it comes blurred. So similarly, so that is why when you take the leads away from the heart and try and picturize the heart from here, the potential that is brought about here is low, you get smaller deflection. So we augment it to get a good reading on the ECG, and that's why it's called augmented voltage, right, left and AVF, right. Now, as I told you that when you combine information from two electrodes, you can get a lead. Fine. So, the information from lead AVR and lead AVL is sent to the ECG machine. The ECG machine analyzes that information and gives us a new lead, which is lead 1. Okay, right? Similarly, information from AVR, this angle, and information from AVF, this angle, both this information is combined to give us what is known as lead 2. Okay. Similarly, information from lead AVL and lead AVF is combined to give us what is known as lead 3. So now we have 6 leads in the vertical plane. Okay. Now let us just, and when you make these 6 leads, now that the triangle that you get is known as the Einthoven triangle. I'll show that in the next slide. Okay. At the center of that triangle is the heart. Okay. So let us just send this up and move to the next slide. Okay. Now, so this is a hexaxial system that is produced by the various electrodes and the leads, right. So we have the 6 chest leads that look at the heart in the horizontal direction, V1 from here, V2, V3, V4, V5, V6. So gives us a cross-sectional electrical activity from the cross-section of the heart. And then we have the vertical leads, right. You have the AVR, AVL, AVF, we have the lead 1, we have the lead 2 that captures potential from these 2 electrodes, and the lead 3, right. And all of this can be plotted in this manner, a triangle, right. The top of the triangle is lead 1 that gives us the potential difference between the right and the left arm, AVR and AVL. Then there is lead 2 that tells us the potential difference between right arm and the left leg, and then there is lead 3. Right. Now, what is the beautiful thing that you have to understand here is that AVR is perpendicular to lead 3. Can you see this? AVL is perpendicular to lead AVL, lead 2, and AVF is perpendicular to lead 1. Just remember this, it will help us understand the second slide. Now, this one basic concept that I want to tell you is whenever a positive or whenever the wave of depolarization is moving towards one of these leads, it will produce a positive deflection. So if you have a depolarization moving towards lead AVF, AVF will have a positive deflection, right. So just remember this point, moving towards the lead, positive deflection. Secondly, if at all you have an electrical activity moving perpendicular to that lead, it will produce a biphasic deflection. So you have an equal positive and equal negative, which means to say that if a wave of depolarization is moving towards AVF, then it will produce a biphasic QRS complex in lead 1 because AVF is perpendicular to lead 1. Remember these 2 important concepts: moving along, maximum positive deflection, and perpendicular biphasic deflection, right. Now let's move on to the next slide. So this is what I wanted to show you. So this is a lead 1. Now lead 1 can be dragged down and brought here. Fine. This is the lead 2, drag it down, bring it here. This is the lead 3, drag it down, bring it here. So now you have a center. Okay. Now, so this is how the hexaxial system is built. Fine. Hexaxial is 6 axis, right. So the axis of the heart, whenever we talk of the QRS axis of the heart, we calculate that axis in the vertical plane using the leads that gives us information from these vertical planes. So which are the leads? AVR, AVL, AVF, lead 1, lead 2, lead 3. So using these we can make a hexaxial system, right. And these are the vectors. So we have a vector lead 1 which is placed at 0 degrees. We have a lead 2 vector that is 60 degrees. We have a lead 3 vector that is 120 degrees, right? Now the AVR looks at the heart from minus 150 degree angle. The AVL looks at the heart from minus 30 degree angle. Okay, understood? So because these are vectors and they look at the angle heart at the different angles, we can actually make an angle which gives us a hexaxial system. And by knowing the two basic concepts that I have told you in the previous slide, that if you have a wave of depolarization along a particular axis, it produces maximum positive deflection, which means to say, suppose your ECG is showing a maximum positive deflection, a positive QRS in lead 2, yeah, which means that the electrical wave of depolarization along lead 2 and the axis is 60. Fine. Now look at the lead 2. Now lead 2 is perpendicular to lead AVL, which also means that if you look at the AVL, right, then AVL will show you a biphasic QRS. Why? Because it is perpendicular. So let us use this concept of hexaxial system and try and answer few questions that have been asked in the exam, right? So ECG with a mean axis of 90 degrees. Okay, go to the previous slide just so that it's easy for you. ECG has a mean axis of 90 degree. In which lead will the maximum voltage of R wave be? Got the question? If the ECG has a mean axis of 90 degree, in which lead will the maximum voltage of R wave be? So axis is 90 degree, and if maximum voltage of R wave is along the axis, right? So that means if the wave of depolarization is moving at 90 degrees, which is the lead? AVF. So that's why that concept I wanted to highlight. Remember, maximum wave of depolarization or the tallest R wave will come along the lead where the depolarization wave moves along. So if the depolarization is along 90 degree, positive R wave will be in lead AVF. Okay, so the answer is very easy, it's AVF. Let's move on to the next question, right? So don't get scared by this question, it is just testing your very basic concept. Now the question is, lead 2 shows a biphasic QRS. Okay, lead 2 shows a biphasic QRS, lead AVL a negative QRS. What is the mean axis? Fine. Now let us try and solve this question. Try and understand the basics while you solve this question. You'll be elated, you'll actually start liking, I know, how to calculate the axis. So let us draw the three. So we have AVR, that's at minus 150, we have AVL, that's at minus 30, we have lead 1, we have lead 2, and we have lead 3. Fine. So the question is biphasic in lead 2. Fine. So biphasic in lead 2, which means the axis is perpendicular to lead 2, right? That's why there is a biphasic, because had it been moving along lead 2, we will get a positive deflection. Now what's the lead that is perpendicular to lead 2? It's lead AVL. So we know that if lead 2 has a biphasic QRS complex, the electrical axis has to be perpendicular, right? Now let's go to the second portion of the question. And lead AVL has a negative QRS complex. So we know that the axis is along this. The second hint is given in the question, lead AVL is negative, which means that the wave has to go not towards AVL but away from AVL, right? If it was going towards AVL, it will produce a positive deflection in AVL. But the question says lead AVL has a negative QRS, which means that the wave of depolarization is moving away from the lead AVL. So where is it going? Have a look. So if this is minus 130, what is diametrically opposite? Plus 150. So what would be the answer? Plus 150. Try and revise this. Try and revise this with various combination with a very basic concept of biphasic and positive deflections. You will never forget how to calculate axis. Okay, so that's the answer, plus 150 degree. Now another way, a very simple way of understanding the axis is understanding this handshake. Call your friend, both of you shake your hands, right? So when you shake your hand, or when this person is shaking hand with this person, imagine this as lead 1, imagine this as lead 3, right? So I am lead 1, you are lead 3, let's shake our hands. So if lead 1 is looking towards lead 3, and if lead 3 is looking towards me, we are shaking our hands with the right hand, it is right axis deviation. Very simple, fine. If we are looking away from each other, it is left axis deviation. So very simple, the simple formula to understand right and left axis deviation. Okay, I'll just tell that, recall it again for you. So if suppose this is lead 1, this is lead 3, you have a QRS complex in lead 1 that is looking down, you have a QRS complex in lead 3 that is looking up, right? Both right hands, shaking hand, right axis deviation. If you have a QRS complex in lead 1 that is away and this is down, that is both looking away from each other, it is left axis deviation. A simple way to understand axis. One is you can calculate. Two, if you grossly see these two leads and have a very obvious QRS complex either looking towards each other, that will be right axis deviation, looking away from each other, that will be left axis deviation. So the normal axis of the heart is positioned between -30 to +90 degree. So that is the normal electrical axis of the heart along the vertical plane. Okay, if the axis goes from 90 to +180, it will be right axis deviation. For example, in the question that we discussed, the axis was +150. So that will be right axis deviation. If the axis goes from -30 to -90, it will be left axis deviation. Okay, and axis between -90 to +180 is extreme axis deviation. So the normal axis, this is a question that is frequently asked, of the depolarization of the heart is -30 to +90. 90 to 180 right axis deviation, -30 to -90